watching ManVsProstate, and once again, learning from so many great leaders and defenders of the Detrusor, such as Defender Tufan Tarcan. He has been such a significant contributor to and inspiration to our crusade and his understanding of bladder health. And this Wednesday at the ICS in Madrid, please attend this talk where the question is being asked, why do so many patients remain on pharmacotherapy after surgery for benign prostate disease? And here are just some thoughts that I'd like to share. We leave men and patients on medications for too long because sometimes I think we forget who we are, because we are defenders of the Detrusor. We swear that oath when we become urologists. We are here to preserve bladder health, prevent late-stage disease, and to end the polypharmacy epidemic. Please remember, from our perspective, medications are not therapies. They are not treating. They are temporizing. They buy us time to triage and to trigger bladder health baselines, which are the stethoscopes with which we can listen to bladders to see if they are under duress or in trouble, needing our help. And then remember to stick to the battle plan that we have, which is stage 1 or part 1 is evaluation, which requires the proper bladder health counseling, the proper bladder health triaging, and bladder health baselines that can help us trigger the right deobstruction when warranted through a blend of shared decision making and looking at the trifecta of prostate size, shape, and Detrusor function. I just wanted to bring this up because Defender Tarcan has been an inspiration to us with all his work with pelvic ischemia and looking at the aging process of the bladder in conjunction with BPH BPO as contributors to bladder dysfunction and damage. And I think that he's been an inspiration, so big thanks. And once again, I think together we can find a solution about intervening for the right prostate at the right time within the window of curability, which is a concept which we've talked about because BPH BPO is a progressive disease that progresses from stage 1 BPO to stage 2 overactivity, to stage 3 urgent incontinence, stage 4 retention, and stage 5 Detrusor underactivity. And we all seek to prevent these late stages of disease with the hope and understanding that it can be reversible if we intervene at the right time. And it requires that we triage using basic urodynamics. We've talked about this in previous vignettes, looking at the right triggers if they have urgent incontinence, retention, IPSS 8 and above alone or in conjunction with low flow, high residuals, thickened bladders, or unacceptable risk that trigger a bladder health baseline with a minimum of cystoscopy. And we do all this work because we want to intervene before it is too late. We often applaud this great study by lead author Defender Kaplan, the 50,000 pressure flow study, which confirmed what we all suspected, right? That as that prostate donut hole gets tighter and tighter, as a man's prostate gets bigger, the flow will slow down and the bladder will compensate with higher pressures up until a breaking point around the age of 62, after which the bladder begins to fail and decompensate. And so we want to intervene within this conceptual window of curability. We applied the missed indication age of 45 years and a Qmax of less than 10 cc's per second and overlaid it on that graph. And what magically appears is this window of curability. Can we intervene within that window before the onset of bladder damage or before the damage is irreversible? And we've all known this to be true from the classic Flanagan study, randomized clinical study at the VA, looking at about 280 patients in the immediate TURP group as well as in the watchful waiting group. And we all saw that those who are watched do not do as well as those who receive immediate deobstruction. And then we watched that with that third cohort of delayed TURP, that they will never catch up and do quite as well as those who had an immediate TURP. And we can see that here with this data between immediate TURP and watchful waiting, that Watchful waiting group had an increased rate of treatment failure, increased incidence of stages 1 and 2, of high symptom scores, of high incidence of stage 3 incontinence, as well as with retentions in later stages such as stage 4. And we also learned from the upstream study that who are the best candidates for deobstruction? Well, those who are clearly obstructed by bladder outlet obstruction index, and those who are not in stage 2 or 3 and with Detrusor overactivity, and those who still have a strong bladder. And you can see, as a result, the best candidates are the ones who are going to be in early stage 1. So let's not allow our men to enter the late stages of BPH BPO, and if we intervene, let's intervene sooner versus later. So I hope that helps. I think that's, oh yeah, and the last slide here, the Finnish defenders and the tribe from Finland have shown us that perhaps timely deobstruction can save lives based on their questionnaire cohort where they looked at voiding symptoms, which would be stage 1, storage symptoms stage 2, urge incontinence stage 3, and you can see a positive correlation with an increased risk of death. 1.2-fold increase, 1.4-fold increase, 2.2-fold increase as you progress to later stages of BPH BPO. So I hope that helps. Please attend the lecture so that you can give us feedback from learning all the latest tips, strategies, and insights from Defender Tarcan and how we can apply that to our crusade. So enjoy Madrid. I look forward to hearing back from you guys. And until then, be well. Take care. Bye.